The oncology nurse cares for a patient receiving morphine sulfate 2 mg IV push Q4H for pain. Which of the following most concerns the nurse? A. Respiratory rate 8 breaths per minute. B. Pain level 7 out of 10. C. Oxygen saturation 98%. D. Heart rate 65 beats per minute. E. Blood pressure. The answer is A. Respiratory rate 8 breaths per minute. The nurse should be aware of potential complications of morphine sulfate, which can cause respiratory depression. Therefore, a respiratory rate of 8 breaths per minute should most concern the nurse. The normal limits are 12-18. The heart rate, blood pressure, and oxygen saturation are within normal limits. A patient on morphine sulfate should complain of pain, and although a pain level of 7 out of 10 requires attention, the respiratory depression takes priority. The nurse cares for a patient receiving an intravenous transfusion of gentamicin through an IV catheter in the patient's left hand. Upon assessment, the nurse notices blanching and swelling at the site of the IV catheter, and the patient states he is feeling 8 out of 10 pain and it is burning. In what order should the nurse perform the following tasks? A. Stop the infusion, aspirate the remaining fluid, discontinue the catheter, and notify the primary care provider. B. Aspirate the remaining fluid, stop the infusion, discontinue the catheter, and notify the primary care provider. C. Notify the primary care provider, stop the infusion, aspirate the remaining fluid, and discontinue the. D. Stop the infusion, discontinue the catheter, notify the primary care provider, and aspirate the remaining fluid. E. Discontinue the catheter, aspirate the remaining fluid, stop the infusion, and notify the primary care provider. The answer is A. Stop the infusion, aspirate the remaining fluid, discontinue the catheter, and notify the primary care provider. The nurse must recognize these signs and symptoms as potential extravasation, where a vesicant medication such as gentamicin, penicillin, Dilantin, or chemotherapy has been given. It is essential to first stop the infusion and remove the insult. The nurse must then aspirate the remaining medication in the catheter to reduce the amount of exposure to the vesicant. The nurse can then remove and discontinue the catheter and notify the primary care provider. The nurse counsels patients at a community health fair about the importance of immunizations. Which of the following statements is most accurate concerning immunizations? A. Immunizations provide natural immunity to some diseases. B. Immunizations will prevent all infectious diseases. C. Immunizations are risk-free and recommended by all healthcare providers. D. Immunizations give your body the antibodies to fight infections. E. Immunizations provide acquired immunity to some serious infectious diseases. The answer is E. Immunizations provide acquired immunity to some serious infectious diseases. The nurse should understand the mechanism of action, indications, and risks of immunizations as they do for all medications administered. Immunizations work by passively providing acquired immunity to specific diseases, such as influenza, hepatitis B, and varicella. They imitate the specific pathogen, influencing the patient's body to produce antibodies that are capable of defending the body if it is exposed to the disease-causing element. The nurse should know that immunizations are specifically made for some diseases, and do not work for all diseases. Immunizations also come with minimal risks, and although they are widely given, are not universally prescribed. Patients should be educated with potential risks. Some patients may experience fevers or rashes. Immunizations do not provide national immunity to diseases, Natural immunity is acquired by the patient when they contract a disease via exposure and the body produces its own antibodies. Immunizations do not provide antibodies to each disease. The community health nurse provides education about infectious diseases to college students in the dorm. Which of the following statements by the nurse would be appropriate? A. Hepatitis C is transmitted through ingestion of contaminated food and water. B. Hepatitis B is transmitted through ingestion of contaminated food and water. C. Hepatitis A is transmitted through ingestion of contaminated food and water. D. Hepatitis D is transmitted through ingestion of contaminated food and water. E. Hepatitis A is transmitted through infected blood and needles. The answer is C. Hepatitis A is transmitted through ingestion of contaminated food and water. Different types of viral hepatitis are transmitted through various routes. Hepatitis A is the only form that is transmitted through the fecal-oral route, contaminated food and water. Hepatitis B and D are transmitted through infected blood, needles as well as sex, and from infected mothers to newborns. Hepatitis C is transmitted through contaminated blood and needles. Recall that hepatitis D is an opportunistic infection, which requires hepatitis B infection. What is the most common type of thyroid cancer? A. Anaplastic carcinoma. B. Medullary carcinoma. C. Papillary carcinoma. D. Follicular carcinoma. The answer is C. Papillary carcinoma. Papillary carcinoma is the most common thyroid cancer, 60 to 70% of all thyroid cancers. Follicular carcinoma is the second most common thyroid cancer type, 10 to 20% of cases, followed by medullary thyroid cancer, 5%, then anaplastic carcinoma, under 5% of cases.